Hello and welcome to Medical Dialogues. I am Dr. Nandita Mohan, and today I will be taking you all to explore the world of rare diseases. And my topic for today will be the Angelman Syndrome. Now, to give us an in depth knowledge about this, we have with us today Dr. Pratibha Singhi, who's the HOD in Pediatric Neurology at Amrita Hospital, Faridabad. She is an internationally renowned senior pediatric neurologist with over 40 years of experience, and she is the president of the International Child Neurology Association and also the founder member of the Child Neurology and Childhood Disability Groups in India. So, welcome to Medical Dialogues, ma'am. It's really a pleasure to be interviewing you here today.
Thank you, Nandita.
Great. So, ma'am, now that we're talking about rare diseases, if you could just provide us an overview of Angelman syndrome and why is it a rare one, and if you can also explain its causes and its genetic basis.
Thanks. Yes, Angelman syndrome is indeed a rare disorder because obviously it occurs rarely and occurs about 1 in 12 to 20,000 people. It's a complex neurodevelopmental disorder. It affects the nervous system and causes physical as well as learning disabilities. It is generally characterized by severe developmental delay. That's what children are brought to us for. Associated sleep disorders, some movements like jerky movements, instability of gait, and frequent laugh. This was described by Dr. Harry Angelman. He's an English physician scientist in 1965. And in general, a person with Angelman syndrome has a near normal life, but they will need support throughout their life. So generally, these children have what is known as inappropriate laughter because they start laughing at anything. They can have jerky movements or flexion movements. The head is often small and speech delay is quite dominant, right from being totally non-verbal to having a speech delay. Children can present with that, and often they can have intellectual disability and seizures, and of course sleep disturbances. So this is also known as happy puppet syndrome because children are a bit ataxic like puppets and they are always smiling and laughing. So this picture is from the source being the care at Cleveland Clinic. I thought this picture represented nicely what the characteristic features are. And so you can see a small head, a short and broad skull, wide mouth, widely spaced teeth, a large lower jaw, etc. And the child being typically happy, excitable, therefore that thing about being a happy puppet syndrome. Usually you do not recognize this. Parents are not, they think the child is normal until their child actually starts showing symptoms of developmental delays, speech issues, balance disorders, frequent laughter, as I said. And then when you examine, the child has a small head. So the diagnosis is often between 3 to 7 years of age, and of course can be earlier in places where you have constant follow-up for neurodevelopmental assessments, etc. The cause is really the UBE3A gene. Now, there's a loss of function of this gene, which is situated on the chromosome 15. Most of the parents are actually normal, and this is a spontaneous mutation, which means it occurs by itself during conception. And this gene stops functioning. What normally happens is that the child gets 2 copies of this gene, one from each parent, but the active one is from the mother. Now, if that active gene is not working, then you get what is known as Angelman syndrome. How do you diagnose it? You can diagnose it only after the baby is born, and the test involves detecting the function of the UBE3A gene. There are techniques which are known as FISH, which means fluorescent in situ hybridization, or chromosomal microarray. And with that, you can pick up on the chromosome 15 that this particular gene is not functional. Now, normal lifespan of the person is there, but the disappointing part is that till date we do not have a curative treatment. So you have to have a multidisciplinary approach. For developmental delay, the child will need occupational therapy, physical therapy, physiotherapies. For the speech issues, they will need communication and speech therapy. And this has to go on as a prolonged thing. Um, if there are associated seizures, then naturally, according to the type of seizures, anti seizure medication needs to be given. Sometimes sleep issues can be predominant, and one may need mild sleep inducing medicines, etc. So, those sort of things are needed.
So you've
Right,
covered the diagnosis as well as the treatment aspect of it.
right, right.
Ma'am, just if you could highlight on the primary symptoms and characteristics of Angelman syndrome.
As I mentioned, the the primary characteristics are developmental delay, speech issues, sometimes seizures, and the fact that the child is a little imbalanced and is always laughing and smiling, and therefore called the happy puppet syndrome.
Okay, great, great. So, ma'am, now coming to the recent advancements, you just mentioned about how it is diagnosed and what tests typically can be used and what
Right.
treatment options are available for managing such syndromic children. So, if you could just discuss out any recent advancements in research or in the treatment aspect for Angelman syndrome.
Right. So, there's a lot of research going on. And unfortunately, as I said, till date, there is no definitive therapy, but people have developed, like, there are some scientists in Texas who have developed this novel therapeutic candidate to target the Angelman syndrome, and which, is it's meant to activate or reactivate the expression of the deficient gene. And this is what is known as antisense oligonucleotide therapy. So I think in the next couple of years, we'll have something coming up as a definitive treatment.
Wonderful. Definitely, we hope for the same. Now, ma'am, one question that I would want to ask you is about genetic counseling. So, what role does genetic counseling and testing play for families with a history of Angelman syndrome?
Right. So, the common questions that are asked by parents are, will I have another child with Angelman syndrome? Because, that's the usual common question that will come. So, the probability of having another baby with Angelman syndrome is almost similar as any other, person, which is
Mhm.
approximately 1 in 15,000 to 1 in 20,000. Why? Because, as I said, that, this is a spontaneous mutation. So it can occur in any child. So in that sense, it's not truly a hereditary disorder in that sense. So, but the caveat here is that if your child has the UBE3A mutation, then there is a little bit of a higher chance to have another child. You know, now I must say that although I have said UBE3A gene mutation is there, there is a small percentage of children in which you may not necessarily have, and
Mhm.
in some cases it may not be 100%. Like 70% functioning may be absent, but 30% may be present. So there is like a spectrum, and that's why children also clinically come up over a spectrum. So, but if it is there, then the chances of having another child are there, like that. And therefore it's important for the parents to know what type, and that's why that genetic diagnosis is important. And then naturally, next before the next pregnancy, a good genetic counseling is needed. Whether which type of, these days we have so many kind of options for pregnancies, and therefore parents can choose, opt for those options. uh, the good thing about this syndrome is that the life expectancy is generally normal,
Mhm.
and over a period of time, in fact, there might be some improvements. So the child, although disabled, but slightly improves over a period of time, which is a little unusual as compared to other neurogenetic syndromes. But we have to be careful about, because of mobility issues, therefore dietary modification and certain exercises, keeping the child active so that the child doesn't become obese, and making sure that the there's no scoliosis, which means the back of the child does not become curved, etc. So those kind of issues, if they are taken care of, then these children can be managed. In fact, I have a child whom I had seen a number of years ago. He's now a full blown adult, and he's easier to manage now than he was when he was a child. And in fact, he even helps his father with their business to some extent. So that's good. Like how you bring up the child, how you rehabilitate the child, take care of seizures, take care of mobility, make sure that you provide an appropriate environment for the optimal development of the child. That's helpful. And then, of course, if you're planning another child, go for a good genetic counseling. That's what I would say.
Great, definitely, ma'am. That's a good piece of advice. Now, coming to the last part, what therapies can help manage the behavioral and sleep issues that you mentioned that are often seen in Angelman syndromic patients?
So, behavioral issues, sometimes these children can resemble children with autism spectrum disorder. Although this is not an autism spectrum disorder, but they can have similar kind of issues. So they can vary from non-communication with other children to being aggressive and hyperactive and not listening to things, being obsessive, etc. So depending on the type of behavioral issues, the management would be directed. And we try not to give drugs as far as possible, just to manage with behavioral interventions. If a child is not communicating, then you encourage play with other children of their age, try to minimize the screen time, put the child in a daycare where you have, or a school where you have children of his or her own age, and encourage, obviously the child will not start communicating immediately, but over a period of time that can be brought out. Lots of occupational therapy and psychological handling is needed for these children. For children with aggression, again, you try to distract them, and once in a while you may even need some therapeutic management for the aggression. For sleep disorders in general, making a good sleep hygiene, making sure that you switch off the lights at a particular time and the child gets up at a particular time, irrespective of which day, Sunday, Monday, Tuesday. So you develop a nice sleep hygiene, with calm atmosphere, etc. So try to have that. If not, sometimes some small doses of melatonin can be helpful in inducing sleep and kind of making a good sleep rhythm for the child. So one can manage these children with the help of various professionals, including psychologists, occupational therapists, rehabilitation people, and of course medical people for medical management.
Great. So, thank you so much, ma'am, for joining us today. It was lovely to be interviewing you and gaining all valuable insights on this rare syndrome. And you've given a very brief outlook on how families and also children can be managed suffering from Angelman syndrome. So, thank you so much for all your valuable insights.
Thank you. And I hope that next time when you take my interview, we'll have indeed a specific therapy for it.
Yes, definitely, definitely. We hope for the same too.
Right.
So, thank you. Thank you so much, ma'am.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.